It's no secret that society in general does a pretty poor job of preparing people for what it will be like in the postpartum period. And one of the most common concerns I hear as an OBGYN is, what will it be like when we go back to having sex? I'm Mama Dr. Jones, and today we're talking about what it's really like to have sex after a baby. Most of these come from a BuzzFeed article that interviewed moms about what it's like having sex after a baby. The first one says, it's like losing your virginity all over again. It's a lot similar to losing your virginity. Your body feels new and vulnerable, and every move is carefully calculated. While I hate the reference to losing your virginity because I find that concept to be ridiculous, like it's having something be taken away from you or misplaced, I definitely agree with the sentiment. Oftentimes you've spent the past 40 weeks growing a human, sharing your body with someone else, and you may even be using your body to feed another human now, and it takes a little bit of time to reintroduce yourself to your body. Not to mention the fact that, everything kind of changes after you have a baby, and that's not exclusive to the vagina or even to people who have vaginal births. Everything from your skin to your hair to your breasts to your abdomen to the vulva and vagina, everything feels and is just a little bit different after you have a baby. And when you go back to having sex, sometimes that's the first reintroduction to yourself. Be patient, make sure your partner is being patient, and give yourself some time to kind of get back into the swing of things. I promise it will all come back. Your boobs will likely squirt or leak milk during sex. One night after I had my second child and my husband and I had a few drinks, my husband got squirted in the eye with breast milk. My boobs were super full because I hadn't pumped in a few hours, and I warned him to avoid that area, but he didn't listen. We were both laughing super hard during sex. First off, I think this comment really exemplifies the attitude you have to have about sex in general, but especially after baby. There needs to be good communication, and you have to be able to laugh it off. Oxytocin is to blame for this. Yes, oxytocin, which you have while you are in labor, is also present when you are breastfeeding and is responsible for letdown, and is also present when you are engaging in things that turn you on or having sex. In fact, it spikes quite significantly during orgasm, and in the process of that, can oftentimes cause leaking or all-out shooting of breast milk. If it bothers you, you can always minimize and sometimes even eliminate this by breastfeeding or pumping right before sex. Some people are into that, so who knows? You might find something new that you appreciate. Sex was pretty damn bad for me. My doctor cut me to get the baby out, which is called an episiotomy, and then gave me 2 unnecessary daddy stitches. Now I can only have missionary-style sex or it hurts way too much. I'm almost 9 months postpartum and the scars still interfere. I feel like my vagina is ruined from being stitched together too tight. The husband stitch. Okay, so this is a idea that people are getting extra stitches put in to narrow the vagina in order to, I guess, be more pleasurable to a partner. This is a largely outdated concept. I can promise you, nobody who is currently practicing as an OB-GYN was taught to do this or told that they should. I do know for sure there are probably misogynistic doctors out there who practice this. I actually see this more from partners generally making jokes about these things at the time of delivery, which grosses me out, but I've never heard any of my colleagues reference something like this as something they actually do. So again, not to say nobody does it anywhere, but it is not a common thing that in our circles would be talked about or encouraged in any way. I once made a TikTok video about the daddy stitch or the husband stitch and how I would like to respond to partners when they make a joke about this, because yes, it has happened more than once. Great job, Mom. You have a teeny tiny little tear down here. We call it a 1st-degree laceration, and it should only take a couple of stitches to make it stop bleeding, and you won't feel a thing because your epidural is working great. So you just hold that baby and I'll be done in just a second. Hey doc, throw an extra one in for me. Sure, how small do you need it, sir? I don't respond like that, but I want to. I do want to bring attention to the fact that not all painful sex after having a baby is related to nefarious stitching on the part of your doctor or midwife. Most of the time, this is going to be related to something else that's going on. About 50% of people will have pain with intercourse at 6 weeks postpartum, and still about 41% of people will report pain with intercourse at 6 months postpartum. So the most important thing to know is that it's really not uncommon, and it doesn't necessarily mean anything sinister went on at the time of your delivery. That being said, you should never have severe pain. If you're having severe pain, you need to let someone know and get seen immediately. If you're having mild pain and it's ongoing, that's something that you should bring up with your doctor or your midwife. No thanks. That's what I was like. I literally went to my doctor because the lady garden was drier than the Sahara no matter what. Apparently, breastfeeding produces the same hormones as menopause, so no libido and sandpaper coochie. Yeah, that is exactly right. When you're maintaining lactation, your progesterone levels are very low and your estrogen levels are very low. And what that does, the progesterone definitely can affect your libido in general, as can the estrogen, but the low estrogen absolutely 100% associated with vaginal dryness, which can lead and often does lead to pain with intercourse in the postpartum period or really any time during breastfeeding. I think this is super important and something we don't talk about in obstetrics nearly enough. It's also very easy to treat. I cannot tell you how many times I have talked to my friends and they've told me something like that was going on. And I say, like, did you bring it up with your doctor? And they're like, yeah, but they didn't do anything. They just told me to use lube, which is a good suggestion, but sometimes you need vaginal estrogen, sometimes you need pelvic floor physical therapy, sometimes you need both, and sometimes there's something else going on that can be picked up with an exam. I do think that low estrogen causing pain with intercourse is something that we, as obstetricians, do not talk about enough. I prescribe for my patients vaginal estrogen. It's very effective. The amount that gets into your bloodstream is minimal. It works mainly at the skin of the vagina to make it better lubricated and have more elasticity so that sex is just not as painful. We use this in menopause as well. Talk to your doctor or midwife if you're having pain with intercourse. Also, I would like to talk about Odela Health, which is a company that I am a medical advisor for and which also I hold a shareholder stake in. So just to be completely transparent, I do have a vested interest in this company. But the reason I have a vested interest in this company is because they are making it easier for you to get a vaginal estrogen prescription if you need it by the way of a legitimate licensed medical provider. Data indicates that over half of people who've had a baby experience some degree of vaginal discomfort, dryness, and/or pain. In fact, I recently asked you on Instagram what your experience with this was, and your answers supported that data as well. However, only about 25% of you said that your doctor or midwife had even addressed this, and a whopping 91% of you reported that you were never offered a prescription for vaginal estrogen, a safe, effective, and ACOG recommended treatment for this problem. Sexual health and function for women and people with vaginas has long been ignored in general and in the online telehealth space, and Odela is working to change that. I have chosen to work with Odela Health as a medical advisor and shareholder in their company because I believe in their mission to make this safe and effective treatment accessible to more people. Odela is a digital health clinic where you can schedule an online visit or submit your medical information to be reviewed by medical professionals who will provide a custom treatment plan and, if appropriate, provide a vaginal estrogen prescription delivered right to your door. While it may not be right for everyone, low-dose vaginal estrogen can dramatically improve symptoms of vaginal discomfort and dryness, particularly when it happens in the postpartum and menopausal times of life. So if you've been experiencing vaginal dryness or discomfort, particularly if you are postpartum or menopausal, check out Odela Health. The evaluation is free. You only pay for a prescription if it is indicated for your specific concerns, and you can get 50% off your first 2 months of treatment by using my link in the description box down below. Unfortunately, Odela is not currently available in every state, but we are actively working to expand that. So if you're interested in this service and it's not available in your area, please check back regularly. You can also comment down below what state you are in so that we can work on getting it expanded specifically to your area. A lot of women get pregnant immediately. Nobody told me you were still fertile right after giving birth. I was young and naive, so I ended up pregnant again immediately, and I had 2 kids in 1 year. It was very exhausting. Absolutely, 100%. It is a very common misconception that you can't get pregnant after giving birth, and it is not true. It's important to know that before your period comes back, you will ovulate at least 1 time, and if you ovulate that time and you get a sperm that fertilizes that egg that time, you may not even have a period before you get pregnant after having a baby. You just need to make sure that you have a plan for pregnancy prevention after birth. I know it doesn't seem like it should happen that easily, but I promise for some people it does. In a nutshell, sex after birth can be very great. I usually never comment on these posts, but I was so surprised after we had our daughter that I think more people should know having a kid definitely does not always mean the end of your sex life. About 3 days after delivering, I found my sex drive, which had completely died in the 3rd trimester due to the fact that I was constantly uncomfortable, had come back stronger than ever. I was dying to be intimate with my husband. Not only was I attracted to him for all the original reasons, but seeing him take care of our daughter, take care of me, and advocate for me when I was dealing with postpartum depression made him sexier than ever. We were fooling around 2 to 3 times a day like when we first started dating. Unfortunately, I couldn't have penetrative intercourse until 6 weeks after delivery, but it somehow made it hotter because we would get creative during that time. And sneaking around, trying not to wake or disturb our sleeping infant added another layer of hot to it all. Nothing is hotter than seeing your spouse become an amazing parent. I liked this and I wanted to include it because it's not all doom and gloom. Sex can be harder to orchestrate, harder to find time for, and physically a bit different after you have a baby. But that being said, you also have this added connection with your partner, and in some cases that can be really good for people's sex lives. Most of the time, your body goes back pretty well to where it was before you had a baby, and almost always, after you've given yourself some time to heal emotionally and physically, once you get past the point, if you're the type of person who has, I don't even know what to call it, where you're tired of being touched all the time, like you've had a baby attached to you, inside you, and then attached to you for months and months. Sometimes it takes people getting through that period where they're like, okay, I can go back to being touched sexually and it's okay. It's different for everybody is all I'm saying, but for the most part, it is very rarely that having a baby means, my sex life is done forever. Quite the opposite, actually. I think most people find the communication, the emotional attachment, kind of what you're sharing together to be really beneficial to their sex life. Obviously, dependent on the situation. I hope that you learned something today. If you're new here and you'd like to subscribe, we would love to have you. I talk about all things periods, pregnancy, and everything in between. Hit that subscribe button, turn on notifications so you never miss an upload. I'll see you next Monday.